Thank you, and good afternoon. As we start our week, I think it is important for us to continue to reiterate and remind ourselves that the best way that we move forward into this new phase, the phase of adaptation, it is important that we do it together. We certainly understand that there is frustration and anxiety and concern and a desire to get everything back up and running, and we would like to do that as well. It's just vitally important that we do it in a way that allows for a sustained recovery. We do it in a way that not only protects public health, but also protects a smooth economic recovery. The best way for us to come out of this is together. As a community, we went into dealing with this crisis together, and we saw incredible results. We've been held up as a model for success in terms of our ability to flatten the curve, expand our health system capacity, get in place greater capacity for testing, tracing, and treatment. And as we come out of it, we need that same spirit to remain with us, that we are doing this together. On Friday in San Diego County, we opened up a significant portion of our economy, large segments of retail, manufacture, warehouse, supply, and logistics. And that is on top of the essential businesses that have been open throughout the duration of this. The state of California estimates we now have 70% of our economy currently open, some with modifications, but at least being open and being back in business. While there is still more to go, another 30%, and many of those are critical components of our life and our economy and what we do. But as we continue to move forward, we are going to have to continue to do it in that same spirit, under the guidance of the Safe Reopening Plan that's been put out, and in a thoughtful way that ensures that we can take a step, be able to measure the impacts, what is happening, allow time for folks to get into new habits, but most importantly, that we do it in an effort that continues to move us forward. Just like we are moving forward as a region in terms of opening our economy, we've moved forward in opening other types of opportunities, opening our beaches a little more, our parks, our outdoor recreation, camping, boating, and other types of things. And we stand before you today saying we believe that we are doing it in the right way. We believe we are doing it in a responsible manner. And so we want to continue that same spirit to make sure we're protecting public health, we're protecting a smooth economy. I do want to address the issue because, again, there seems to be some lingering concern over the issue of local variants or local counties' ability to move separate from the state. The governor made clear again today that the entire state of California will continue down a path of reopening. We saw that last week. He's alluded to the fact there could be more business sectors that are opened this week. That is what we are operating under, and that's the path we want to stay on. Some counties are choosing, because of the conditions on the ground, to move slower than the state of California. Some Bay Area counties have not yet instituted the retail openings that we did last week. Some of them are just now bringing online construction, something that we never stopped here in San Diego County. But every county has the ability to move slower in a more restrictive fashion than the state. We have not done that as a county because our facts and numbers and conditions on the ground do not warrant that. There are a handful of counties that meet the threshold to move much faster than the state. Those are primarily rural counties. They are much smaller counties. They are in a much different situation. In order to have that flexibility and freedom, not only is it the number of deaths, but there are a variety of factors that have to be met, including every hospital system signing off that they concur with the decision. That is an unlikely scenario as it presently stands for San Diego County, but that does not stop us from continuing to move forward in stage 2 with the state of California. And so we took a huge step forward last week. We expect more steps to be moved forward this week. And so we will continue that all together as a region, awaiting any changes for what may happen. And so, again, tremendous progress over the past few weeks. That progress to date continues to demonstrate in the numbers we are doing well, and we need that to continue. The only thing at this point that would significantly slow us down would be a change in our conditions, and a change in our conditions would be brought on by a change in our mindset and our commitment and our posture. And we know that if we stay together, if we follow the orders, if we look out for one another, and if we adapt our actions, we can continue to be a model for our region. Over the weekend, I participated in an announcement with the YMCA of San Diego County. In summertime, when schools are out, they are the single largest provider of child care services. We know that you cannot begin to reopen an economy and expect parents to go back to work if there are no options for child care. And so I was pleased to stand with the YMCA as they announced the opening and beginning process of opening their summer camps. They're going to do it responsibly. They're adhering to the public health orders. They're going to do it in a way that protects as best you can the public health of both their workers and our children. But this is a significant step forward, and I want to say a special thank you to the San Diego Foundation for taking $1 million out of the Community Response Fund and donating it to the YMCA Summer Camp Program to aid and assist in providing vouchers and scholarships for low-income families and also to assist in their startup costs. We know that there will need to be more work and effort around child care as we begin to get more sections of our economy going, but this is certainly a step in the right direction. We're going to get to testing in a minute, and I just want to let you know there was considerable energy and effort over the weekend around issues of testing, both on issues of supply chain and personnel protocols, working with the state to ensure we get expedited on shipments of vital components we need to execute on our testing. And we are in a period of uptick. We are in a period of stepping up what we are doing related to testing. If you go back, in late April was the first time we saw 4 consecutive days with 2,000 tests conducted per day. That was the first time throughout the duration of this that happened. If you go to last week, it'll be the first time you saw 4 consecutive days of 3,000 or more tests conducted. Again, we are stepping up. We want to see that go into the 4,000 range, the 5,000 range where our present goal is, and then continue to go beyond. Today, our numbers are down a little bit. On Saturday, we reported 3,401 tests conducted. Sunday, we reported 3,443 tests conducted. Today, we are only reporting 2,638. Sundays are always a little bit of a dip. The drive-up testing for the state is not operational on Sundays, and apparently a lot of folks do not want to spend their Mother's Day going to get a test. But Mondays have always been a little bit low historic, but we believe that we are on the right trajectory, and we want to continue to do that. I also wanted to share issues of face covering and broad spread compliance. We are hoping, as this has been socialized and worked around, that folks will understand the vital role face coverings play in a recovery. We've done a lot of things in providing face coverings to law enforcement to be able to distribute as a part of an education, a very soft form of enforcement as we strive to continue to try and get widespread adherence. We are also working with the Metropolitan Transit System and MTS on providing some face coverings to them that can be made available to individuals who are utilizing the MTS system. And we will keep looking for creative ways to make it easier for individuals to obtain a face covering and provide, again, a soft form of enforcement to try and get wider spread adoption. On the subject of MTS, I would just like to take a moment and send our deepest condolences to the family of the CEO of the Metropolitan Transit System, Paul Jablonski. Paul passed away unexpectedly yesterday. He was a great leader for our community, a very committed public servant. He ran a great agency, and he was someone who certainly grew on me personally over the time that I worked with him as chair of that agency. And so to Debbie and her family and everyone out there and all the staff at MTS, we send our deepest condolences on the untimely death of Paul Jablonski, and he will certainly be remembered. Now we'll go into our T3 chart. Here you can see we did 2,638 tests, which I just mentioned. We're over 82,000 cumulative tests. We continue the process of backgrounding and beginning the training, onboarding type efforts around our contact tracers and investigations performed continues to go up. We presently have 197 individuals in our public health motel rooms, 643 cumulative. Today, we are reporting 139 new positive tests. Again, this is out of the total we reported of 2,638. You can see right there, which is 5%, and I want to reiterate, we say this every day, the number of positives is less significant. It's actually not that significant at all. It is relative to the total number of tests being done. And you can see the overall downward trajectory of the percentage of positives. We believe as we continue to increase testing and we begin testing a wider variety of folks, we expect this number to continue to trend downward or hold flat and steady. But again, you can see the 4 days there, over 3,000 tests a day we alluded to. This is a stepping up, and we will have variation days here and there, but on the whole, we're headed in the right trajectory. We want to get there. We want to get there fast, and we will continue to work on those efforts. Likewise, in our hospital daily census of COVID-related folks, you see in the orange there, the COVID-related ICUs, 142, basically holding steady and flat over the course of the last week. Again, we explained last week there was a little uptick here when some new hospitals came online and started reporting. Nothing alarming in that. And then the total there at 390. That is both ICUs and non-ICUs that are COVID related. The next one again tracks our total hospital capacity and utilization. This is both COVID-related patients in orange and non-COVID-related hospital patients in the blue that you see right there. And again, generally very flat. Our final chart is just our cumulatives. You see we're over 5,000 cumulative positives as a region, almost 3,000 estimated recovery, cumulative hospitalizations with a doubling rate of every 37 days, cumulative ICUs with a doubling rate of every 54 days, and then the unfortunate loss of life there at the bottom. That concludes my section of the report. Next, I want to turn over to Dr. Wilma Wooten for a Public Health Officer's report.